Hello everyone and welcome to week number 2. This week what we are focusing on is minor surgery and infection control. So for this week we are focusing on 2 chapters, both chapter 34 and chapter 42. So again, in these videos I'm going to take some time to go over some of the important highlights. Other areas will be covered both in your personal reading and also in your lab class. So chapter 34 starts off by discussing infection control. Infection control is the process of reducing exposure to pathogens and preventing the spread of diseases. Pathogens are disease-producing organisms, and they are found everywhere, including both inanimate and animate objects like humans. As a medical assistant, you need to be aware of how easy it is to really spread those pathogens from one host to another. So for this reason, we follow a term called asepsis. Asepsis is a state of being free from germs, infections, and other types of microbiological life. When we talk about asepsis, there are 2 types of asepsis. They are called medical and surgical. Medical asepsis is essentially called the clean technique. It includes things such as wearing your corrective personal protective equipment and making sure that you wash your hands. Surgical asepsis, on the other hand, is considered a sterile field. So that means that you are removing all microbiological endospores and any potential bacteria. You will want to make sure that everything is clean and sterile before that you use it in surgery. Now, in order to really understand how this works, we need to understand what microorganisms are. And those are organisms that are so small they can only be seen with a microscope. But not all microorganisms cause diseases, but those that do are called pathogens, as we learned from the last slide. There are 4 main types of microorganisms. They can either be bacteria, fungi, protozoa, or viruses. Now, all of these will need food, moisture, and darkness to really grow, but bacteria can grow in one of 2 ways. It can be either aerobic or anaerobic. Aerobic means that the bacteria needs oxygen in order to live, where anaerobic means that it does not require oxygen to live. So now that we really have an understanding of microorganisms, you need to understand how infections are spread. And they are spread through what we call the chain of infection. There are 5 links in every chain of infection. The first one is a reservoir host. This is where the chain begins, and its microorganism is typically a human or an animal. So they're pretty much the ones that start this. Next, we have our portal of exit, and this is how pathogens are spread from one host to another. And that can include things such as their respiratory tract, urinary tract, reproductive tract, or any open wound. Chain link 3 is a means of transmission, and this can either be direct or indirect contact. So it could be coughing, sneezing, kissing, sexual activity, passing a cut through a handshake, or something to that effect. Number 4 is the portal of entry, and this is how the pathogen gets into its new host. And typically that happens the same way it left the previous host, or that reservoir host. And finally, we have the susceptible host. And this is someone who is able to carry the infection because they're unable to fight off this infection that's been put into their body. They become the susceptible host, and after a few days they become that reservoir host that then transfers it on to the next person, and the next person, and the next person. Now, one more thing that I want to talk about for Chapter 34 is talking about the stages of infection. So once an infection has begun in its host, it goes through specific stages. And there are 6 specific stages that the infection will go through in total. It will have an invasion stage, which is where the pathogen enters the body through the portal of entry. Multiplication, which is where that pathogen gets reproduced. The incubation period, and this can last anywhere from several days to several months to several years. During this time, the disease is developing, but you don't really have any symptoms. Stage 4 is the prodromal stage, or the prodromal period, and this is where your first mild signs and symptoms appear, and you're typically very highly contagious during this period. After that will come the acute period, where your signs and symptoms are evident, and they are the most severe at this point. And finally, that last stage, which will be recovery. So recovery is definitely one of the bigger, happier places because your symptoms are starting to subside and you're starting to feel better. All right, so that is Chapter 34 for you guys. We're going to move now to Chapter 42. And Chapter 42 is talking about assisting with minor surgery. So medical assistants can perform many different duties related to minor surgery. Typically, they happen before, after surgery, but you do have some responsibilities during that surgery as well. Before surgery, you will make sure that all of the correct insurance forms are completed. You'll make sure that you obtain informed consent from your patient, stating that they know all of the risks, the outcomes, the probability of any sort of maybe contraindications or things that could go wrong during surgery. And you're also going to meet with the patients and make sure that you answer all of their questions so as they go into surgery, they are feeling 100% about it. Now, after surgery, you have some very important roles as well. Based on provider instruction, you will provide the patient with their post-operative care and give them instructions, including that if they have a wound that they need to take care of. But you're also going to, after surgery, deal with cleaning up that procedure room and dealing with the instruments that were used. You'll perform things such as sanitization, which is the cleaning process that inhibits pathogens through careful cleaning of the equipment and the instruments to remove any debris that was put on them during surgery. Then you're going to disinfect things, which will help to destroy the activity of any microorganisms. During this stage, you'll either use chemical germicides, flowing steam, or boiling water. And the last stage is using a sterilization technique, which what happens in that is we kill off all endospores, typically using the help of an autoclave. Now, as a medical assistant, you can work with procedures, as you obviously already know, and during that time, you'll use surgical asepsis. So surgical asepsis, again, is the sterile technique that is used when the sterility of supplies and the immediate environment are required. So any time that you're doing surgical procedures or any invasive procedure, you'll need to use surgical asepsis. Some examples could be administering an injection, making a surgical incision, or working with an open wound. Now, there are some guidelines that are required during surgical asepsis. First and foremost, you'll want to make sure that you use a surgical scrub. That will be very different from that of your actual everyday normal hand wash. In your labs, you should be dealing and having the ability to perform this. Otherwise, you can find information on that in your book under certain procedures. You'll also want to make sure you use sterile gloves. So these will be different than the ones that you use for everyday use. They should be packaged. And we want to make sure that anytime we have a sterile pack, we're keeping that sterile pack sterile. That 1 inch outside border is considered contaminated, so you don't want to touch anything inside the package with your bare hands. And you always want to work with sterile instruments. Now, instruments are very interesting because they are classified based off of their use. So when you're trying to determine what kind of instrument you have to ask yourself, first question is, what does it do, or what is its use? Does it cut? Does it dissect? Is it used for grasping or clamping? Does it help to dilate, or do we use it for probing? Is it a visualization tool, or is it used for suturing? So after you ask those questions, then you want to look at what kind of handles does it have? Are they ringed or are they serrated? What does the tip look like? Is it pointed? Is it blunt? Does it have teeth or no teeth? What type of closure does it have? Is it a spring closure, a box lock, or a ratchet? What kind of edges does it have? How long is it? And asking yourself how long is it helps to determine where it could be used in the body. And the last thing I want to talk about is becoming a good scrub nurse. So as you can see in the picture on the left, the scrub nurse is the one obviously standing with the instruments, because their job is to hand them off to the provider. But while you're there, you want to be able to anticipate the needs of your physician. Make sure when you're handing them instruments, you're doing so carefully. You place it firmly in their hand so they can't drop it or lose it. When you want to make sure that you are watching everything that happens so no injuries occur. And after the procedure, you want to make sure you have an account of all of the materials used and the instruments used during that procedure, so that way we know that nothing gets left behind in the patient's body cavity. Alright guys, so for this week you have a few assignments. Your first assignment will be your Module 2 discussion, which is dealing with the exposure to bloodborne pathogens and the hepatitis B case study. Your initial discussion post will be due on Tuesday, January 10th by midnight, and you'll need to reply to at least one classmate no later than January 14th, which is Saturday. Also this week, you'll have to complete your hepatitis B VIS summary. This will be due Sunday, January 15th by midnight, and you do have one quiz this week, which is on your personal safety. Again, due Sunday, January 15th by midnight. If you have any questions or concerns, please make sure that you reach out to me either via email or you drop me a phone call. And I hope everyone has a wonderful Module 2. Bye, guys.